Remember, the first and the second phase is to cover 30 crore people. This is going to be one of the largest exercises in immunization taken worldwide. But there are a number of questions that need to be addressed at this stage, especially for the phase 2 of vaccination. There are three major differentiators from last time. Besides, of course, the categories, because this time it is going to include the elderly, the ones who are above 60 years of age, and the ones between 45 to 60 who have co-morbidities will also qualify to take the vaccine. The other big differentiator is the fact that now you can walk in and register and get the jab if you choose to do so, of course, by following the due process of registration. And then the important difference this time around is that the private hospitals are allowed now to pitch in and they have been roped in to in fact also undertake this huge exercise. The CoWIN app, a lot of glitches there are being corrected. This time around the Arogya Setu app is also being integrated. Apparently you can also register through that. We'll get all the clarity in due course. But we have to address the most important question on whether the infrastructure facility across hospitals, whether the trained workers are ready to undertake this process, because this time the volume is much larger. And also then we will talk about whether the whole idea of vaccination as the most effective solution right now is something that we can buy in order to curb the spread. Can it really break the chain of transmission? That is becoming a cause of worry in at least 8 states across India. So to help me understand all of these issues, to help our viewers understand all of this, let me welcome my guest this evening, Sangeeta Reddy, who is the Joint Managing Director of Apollo Hospitals Enterprises. Sangeeta Reddy will be with us for a brief while, but we'll address our important questions with her on the issues of facilities and the systems that have been put in place for the process to begin tomorrow. I also welcome Dr. Vishnu Panigrahi, the Group Head of Medical Strategy and Operations from the Fortis Healthcare, to talk about the medical infrastructure again and to help us again understand whether we are really prepared for this mammoth exercise. I welcome Dr. Virendra Singh Chauhan, who's an emeritus professor from the International Center for Genetic Engineering and Biotechnology. Dr. Chauhan will again help us understand whether vaccination as a solution will help us as a country at the juncture that we are in right now. Dr. Anup Amarnath, who is the chairman of Geriatric Medicine Manipal Hospitals, also joining us. He's a member of the Critical Care Support Unit of Karnataka. I'm going to address questions related to herd immunity and a number of other issues that people are asking today on how far vaccination can help us and how far second phase of vaccination will take us in combating the COVID crisis. So I want to first go across to Sangeeta Reddy on this. The question that we are raising here, Sangeeta Reddy, is that depending on which state you are, the facilities, the systems are going to be different. But we are already getting objections, or rather statements from some states that it's way too early to start right away from the 1st of March. The guidelines only came up this evening. Do you see the country actually picking up from here and going ahead with phase 2, or do you see that, yes, there are certain hurdles and certain wrinkles that need to be ironed out in the process?
So clearly any endeavor of this scale, this complexity, and which is approached from the aspect that we all need to do it in a unified, integrated manner, is going to take some level of planning, some level of debugging in terms of the system. But I think most places which are approved are ready to start in a small way. So for example, Telangana said, please do only 200 patients per day in your approved center. Let's streamline everything, maintain this pace for 3 days, and then we'll scale up. So I think the important part is that many new centers will start on Monday, if not Tuesday. And over the period of the week, probably we will see that, these will be able to participate. I think during this time, it's also a good idea for us to look at expanding the network, even if we do smaller numbers per center, but expand the network because there is the unifying app. And as of now, CoWIN, which is the underlying most important platform, we've received a good user document on that platform and how it can be used. It is not yet open for public to register, but I would urge everyone to keep a watch. Maybe first thing tomorrow morning, start registering. because for Monday, Tuesday, Wednesday, it is primarily people who have registered on COVID, which will get allocated your centers. At least this is what the Telangana collector clearly gave guidelines to our medical team today. And then subsequently, the walk-in strategy will also work where the hospital will help the individual register on COVID. But I think we're all ready for a good ramp up.
Okay.
I also believe that it's important for each center to be very clear about their own cold chain. Because there is an intermediary cold chain that we need to maintain.
Okay.
We at Apollo have studied this system and put our processes in place. We've also worked on the registration, pre-briefing and screening, then the vaccination, and then the post-vaccination monitoring for the half an hour, 45-minute period, and then subsequently to stay in touch in case of any kind of discomfort or complication, and then to call the individual back for the second dose. So this process needs to be very clearly adhered to, but
Right.
it isn't difficult, and I think all of us are ready.
Okay. Yes, just one quick follow-up question, since I know you're going to leave us early, on the issue of walk-ins. Because this is something new that's happening this time around, do you think we have enough trained personnel, we have enough infrastructure to handle a situation where people can just walk in and then ask to be registered? Or do you think those who have pre-booked, and like you said, you're urging people to register themselves, do you think they will have the advantage?
I think that, what we need to do is encourage as many people as possible. We must be aware that there is an underlying vaccine hesitancy. So after the first wave, where all those who have been, really waiting and committed to take the vaccine, after that, we have to make it as easy and as convenient as possible. And that's why the walk-in strategy, I believe that all our centers can handle it. And by all, I meant the private sector can handle this.
All right.
Okay.
Okay, that's a very good, in fact, a positive note, in fact, for us to go ahead with the rest of the discussion. Thanks, Sangeeta Reddy, for joining us. I want to put that question also to our other guest, Yes, sure.
If I may add one more thing. One is, I think that the price has been kept very effectively low, and therefore it should be very convenient. And the second thing is that in the expansion of the network, right now, only hospitals who are either registered on Ayushman Bharat or with CGHS have been recognized or put on the network. I believe all hospitals who served during the COVID period, because they already have a large base of patients who may need them, as well as maybe hospitals who are NABH accredited. So that criteria may be adopted in the next few weeks. I'm hoping that the government will expand the number of private hospitals who can do this process of vaccination. But with this, I think we're all very hopeful of a good beginning. And I urge citizens to please come forward and get their vaccination. Okay, thank you. Namaste.
Sangeeta Reddy, really a pleasure to have you with us on the show, and for all the important points of view that you shared with us, the advice to the government of India, also the importance on the thrust on the on expanding the process of vaccination is important at this stage. Let me go across to my other guest now, Dr. Bishnu Panigrahi. I want to ask you from your perspective as well, in terms of the ground level preparedness. Are we ready to go ahead with phase 2? Do you have any particular concerns?
No, thank you for inviting me for this session, because it's very important, because print and electronic media is something that they have to spread the message. As far as Fortis Healthcare is concerned, we are ready, because if you'll we go back to January 16th, after the rollout happened, we had done our dry runs. Then after that, we were prepared when the vaccination started for the healthcare workers of Fortis, and then we started also vaccinating frontline workers who came to Fortis different facilities. And the similar thing happened in the other healthcare chains also. So the first dry run was done very well. Obviously, at not the scale that the government desires to implement by 30 crores by August of this year. And in fact, what Dr. Sangeeta Reddy did mention was that she was the president of the FICCI Health Chapter, and we have from the industry, whether FICCI or CIA or AHPI, we have been telling the government that the private sector also wants to partner with government because if you have to do 30 crores, you can't do it at this pace. We have to step up, and health has no boundaries between health, private and public, and the health transcends everyone. If you look at this, when this pandemic
Yes.
happened, the rich, poor, everyone got affected. So the health sector, and speaking about private sector, they are very upbeat and they're ready to take it on. In fact, we are already prepared. All our hospitals, which have been earmarked to be the vaccination centers, are ready for it. And if you see the announcement, government looks at about 10,000 public sector and 20,000 private sector. So we are ready for it, and I don't anticipate anything. And we are upbeat. And
Okay.
the message to the public is that please come and be rest assured that the vaccines that have been rolled out are fine. I have taken both my shots, so are all the senior clinicians, and none of us have had any major reactions or any major issues.
Okay, so that's again a very important message that you are sending out, that there should be no vaccine hesitancy. We cannot afford to actually take a step back at this stage, because if you are above 60 years of age, you should be going ahead and registering already if you haven't done so. And if you are above 45, you can, and with comorbidities, you can check the criteria that is set. And let me tell our viewers here that just today we've had the framework released by the Government of India, by the expert group, the National Expert Group on Vaccine Administration has given out a detailed criteria. So you have to make the effort to go and check whether you qualify for the category of ones with comorbidities who's above the age of 45. And then, of course, like Dr. Panigrahi said, do not hesitate to go ahead and take the jab. There are no major concerns with the vaccines that we have in India. Dr. Virendra Singh Chauhan, now the question also, of course, arises on how we are seeing a surge in at least 8 states across India. These 8 states are contributing to around 86% of the total caseload. So already the surge is picking up. Do you think that we are just at the right time introducing the vaccine 2.0 in that sense?
Oh, absolutely. I just want to put this in perspective for your viewers that many parts of the world, vaccines still haven't reached, and virus has reached much earlier. So we are in a position where people should just go ahead, and you have said that, and both the earlier speakers have said that. But let me just share quickly what is new on the vaccine front itself, and partly hesitancy. So I'll just take the first one. When the phase 3 trials were done with the vaccine, there are 8 vaccines now in the market, different markets. When the phase 3 trials were done, the end point of the phase 3 trials were whether you are protected from severe disease or not. And the question was raised, and many times we didn't have the answer at that time, whether the vaccine will protect you from getting infection and then transmission of the virus further. And if somebody told you that they go and take a vaccine, but you'll still get infected and will spread it, you'll say, oh my God, there is hardly any transmission. Why should I take? So I just want to share very recent, good quality scientific data, which obviously could come only now because a very large number of people have been followed who are vaccinated. And the latest data is the vaccine actually does even protect you from getting infected and reduces the chances of which is quite obvious now. I mean, logic would demand that if you're immunized. So the other very important thing happened today is the single shot vaccine, Johnson & Johnson, has been approved in USA. So this is a single shot vaccine. You don't need to come back.
Yes.
Third very important point I must say, there's a lot of scare about mutants, whether surges are mutants or not. If I took vaccine, am I protected against mutant or not? And we could not answer this question some time back. Limited study had suggested there could be some escape mutants, so there was a worry. And South Africa did stop AstraZeneca, halted AstraZeneca rollout of the vaccine. But the latest information that is beginning to come out, that the most mutant viruses, by and large, are covered by vaccine. So finally, I'll say to you and to your audience, this is the best chance we have to reduce infection, that all of us, all adults, should go ahead and get vaccinated. Safety is no issue. We know that. Everybody, so many people have been...
Dr. Chauhan, yes.
efficacy is no problem. We know they are efficacious.
Yes, one important point that you made, and I want to reiterate it because people have doubts around this issue, and the fact that you come up with this point is interesting. I was anyway meaning to ask you that when you said that, for vaccine, as we understand it, and common man's perception is that it will only give you antibodies and you will not fall terribly sick, but you could still get infected. What you're telling us today is that there is recent research to show that it also protects you from getting infected, which will be a very important thing to note because we are now looking at breaking the chain of transmission. And prior to this, we did not have clarity whether vaccines can really do that or not.
Yeah,
yes, I want to go across to Dr. Anup Amanath as well.
Let me clarify.
Okay, please carry on quickly.
Just clarify. It protects you as much as vaccines are protective, as we know, from 70 to 90%. The information that I gave you is not 100% protection, but we didn't know earlier whether it protected at all or not. So we know now more than 50% people are going to be protected even from asymptomatic infection, which is fantastic news for going forward for vaccination.
Absolutely. That message should therefore go across, which is why I underlined it. Dr. Amarnath, I want to ask you, on the issue of how people now are having this question about how far are we from conquering this battle, from winning this battle, because there are a lot of questions around achieving herd immunity as a country, and it seems that in the first phase the target was 3 crores, a little above 1 crore were vaccinated. In the second phase now another 27 crore is to be vaccinated by August 2021. But at this rate, for a population of 130 crores, how far are we from meeting the desired results?
So I would, answer this in 2 parts. Number one, I personally feel that it wouldn't be an exaggeration to say that it's a watershed moment from tomorrow, primarily because if you look at the data, apart from vaccinating the healthcare workers, the highest mortality rates and the case fatality rates were in the elderly population, the 60 plus. So I think this wouldn't be an exaggeration to say it's a watershed moment because they are the ones who are now getting the vaccination, and you can significantly reduce the case fatality rates and mortality rates. And number two, apart from this vaccination, I would like to say that vaccination is just one part of the entire armamentarium that we have in the fight against COVID. And I don't think we should be lax and say that, once the vaccination is done, we are able to conquer this entire thing. So I think vaccination should not be an alibi for our irresponsive behavior. So the masking continues, the distancing continues, and the hand washing continues. This is just one extra tool that we have in our fight against COVID.
Yes. All right. Yes. Okay. Right. So on that note, I need to close the conversation here, but we got some very important points of view and clarity on a number of questions that have been haunting all of us. Tomorrow is a big day, and of course, first I would like to thank my guests for joining us in this conversation. But yes, if you are above the age of 60, go ahead and register in one of the 2 apps that are designated. If you are above 45 with comorbidities, you could qualify for it too. Do check the criteria that the government of India has already uploaded, and the information has gone out to states, gone out to all the states. And of course, we all should brace up now to take on this challenge and prepare ourselves to get immunized. Thanks for watching Urban Debate this evening.